Rooftop rumbles, laundry room lesions, and street side sneak attacks. In honor of the new game release, we are officially joining Task Force 141 and breaking down and reacting to all of these shocking medical scenes and combative injuries from Call of Duty Modern Warfare 3. Let's dive right in. Oh! People come into the emergency department all the time where they're hitting, punching, kicking, getting hit by different objects. Getting a blow to their solar plexus actually has to do with the epigastric area relating to like nerves. The knife. In the emergency department, we actually look at the abdomen pretty much in quadrants, and then we add the epigastric area, which is where your stomach sits, but your pancreas sits there as well. The duodenum kind of sits close in that area. So different organs that we identify when there's trauma and injuries. A jab right to the throat. Getting hit in the throat like that could cause a spasm to the vocal cords, which are made of muscle, so they can spasm close, make it difficult to breathe. Also cause you to feel stunned and just off for a second. Could you actually break cartilage? You possibly could. Would you collapse down to the ground? Probably unlikely. Oh. I don't think the forehead hit to a helmet would do much unless you're getting right to the nasal bone, which is exposed, but you run the risk of injuring yourself. Oh, a chest shot could go straight to the heart, could hit the lung. Obviously, you see blood splatter going backwards, so it's through and through. When we think about a collapsed lung, hemothorax, and pneumothorax. Not sure exactly where that went. Could have went face or neck. Hitting the neck, a lot of soft tissue there versus hitting straight through the airway. You're either dealing with an airway problem or bleeding problem. Whoa, whoa. A hit to the back of the neck causing hyperextension injury, so you can fracture your vertebrae. As it hyperextends back, you can snap the transverse processes, you can snap the spinous processes. Not really gonna do that much more outside of maybe you can potentially rupture some anterior connective tissue.
Destroy the target.
Oh, whoa. Massive, quick hyperextension this way. Could you cause significant injury, death? I mean, if you pull hard enough and cause enough injury to the spinal cord at a high level, yes, there could potentially be massive injury, but it has to be high up. It's got to be close to the brainstem. It's got to be high cervical injury. Hitting somebody in the face with your own face, obviously you do run the risk of missing and causing an issue. You can actually get dazed and feel dizzy, like you're gonna pass out. Make sure that your mouth is actually not open, and make sure your tongue is out of the way, because sometimes when your mouth is open and you have that type of force, you can actually bite down on your own tongue and then cause significant amount of bleeding and injury. I've seen injuries to people's tongues and they just bleed like stink, and they're really hard to get to stop bleeding.
Hey, covering your six.
Oh, to play this game, you have to have focus, you have to have energy, you gotta be up. So if you guys need a little extra boost of focused energy, check out the supplement Level Up from Life Happens that I'm a part of. You're gonna really like it. Does that assailant die, or are they just going to sleep because they can't breathe or they've been knocked unconscious? So if somebody's been knocked unconscious due to head trauma, it could be seconds, minutes, hours. It just depends on what type of trauma is going on to the brain. Is it just a contusion? Is it a concussion? Is it actually an intracranial bleed with skull fracture? Many different scenarios I can think of. Oh, you have different types of ligaments, not just on the back of your vertebrae, but also in the front. You know, some people have these chronic medical conditions that turn something into what we call bamboo spine, where the spine doesn't actually bend well because the ligaments actually start becoming hard and almost calcify. But in this situation, you could be ripping those ligaments, and it actually just makes the vertebral column unstable.
We've lost the lead.
Oh, shots to the back of the knees could go straight through, actually hit the bone, can shatter the bone. I've actually had patients come in with accidental gunshot wounds to their legs due to self-inflicted wounds by accident. And you see that the bullet just like shatters through the bone, can break the bone, or it could just be soft tissue injury.
We're losing Charlie.
That close to somebody's head, front, gonna cause a big explosion basically, which then will cause significant amount of trauma, bleeding, and incapacitation.
1 minute remaining.
Oh my gosh. Not to be graphic, but you literally see bone fragments flying. That probably is what happens. I've seen mostly skull fractures and fragments due to blunt trauma versus bullets. Most of the time we see missing bone when somebody actually has blood trauma to their head from falls.
Hostile Guardian is active.
Oh!
Enemies inside the perimeter.
That move must have been practiced because of the fluidity of it. Blade to soft tissue of the mid-abdomen, just gonna cause some discomfort. Right side of the neck is what it looks like. It sounds slicing, but it almost looks like a puncture wound. Stab, twist, probably. The concern is getting into the airway, esophagus, and then obviously soft tissue. And what lies over there is your carotid artery and your jugular vein. So hitting those could cause significant amount of bleeding.
Target area.
Big weapon to the back of the head, again causing injury, just stunning the individual and then using a close range shot. Basically stabilized. We always worry about airway, breathing, circulation, and then actually disability and exposure. Those are the things we're focusing on, but put an airway in if you need one. So intubate the individual, put them on a ventilator, and then make sure that they have blood pressure and a pulse. So you're kind of doing all this at the same time.
We're taking Bravo.
Inside kick to the medial aspect of the right knee could cause an injury to the lateral aspect of the knee if it's stuck in the ground, so to speak, like soccer players on AstroTurf, or it just could cause some contusion and throw the body off balance. Typically, the worst injuries that we think of when it comes to the knee is actually the opposite, hitting on the lateral aspect going inward, because then it could actually rupture the medial collateral ligament that's attached to the medial meniscus, and then as well as the anterior cruciate ligament.
Oh, it's compromised. Get it back.
Oh my gosh. So shooting bilateral upper extremities, you know, if you're hitting into the biceps area, you got to worry about the major artery that runs along just where the humerus is. If you actually grab your arm here, push on the inside, you can actually feel your own pulse. We actually check for pulses in infants in that area. So you can have significant amount of bleeding. I've seen patients that have had knife wounds, box cutter injuries to that area where there's massive amount of arterial bleeding that needs to be controlled. Whoa, be careful up on a roof. Come on.
Come on!
Landing from that far of a jump. Ask those people who do parkour. That's hard to do and stay upright. Game designers, what are we doing?
Charlie.
Oh,
Enemy is taking Bravo.
if you get close enough distally of the upper extremities, depending on the bullet, right, you can cause enough trauma that it might actually almost sever it. We've had people that come to the emergency department in the civilian world where they actually sever their hand due to different heavy machinery, and there's not much to do. You can't really put it back on unless it's a perfect cut. So you're trying to control the bleeding and minimize how much tissue damage has occurred and how much tissue is left. I actually enjoyed that, and seeing the different weapons that are available, super cool. We got the knife wounds that were cool, the hit to the neck, super cool. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. If you guys enjoyed this, definitely check out this playlist right here. And as always, please subscribe, turn your bell notifications on, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.